If you're pregnant, or say if you have kids, even a newborn, should you think about chiropractic care? Well, that's exactly what we're talking with our coastal expert about today. Joining me now is Dr. Allison Arvin, who is a chiropractor with the Joint Chiropractic. Hi, Dr. Arvin. It's great to see you.
Nice to see you too, Natalie.
So let's jump right in because,
Sure.
you know, when a person is pregnant, that might be something that they don't always think about, chiropractic care. So why should women get adjusted when they're pregnant?
Absolutely. I mean, your body is going through a lot of changes when you're pregnant. And some of them you can see. Obviously, that adorable little baby bump is just growing right away. But some of them are actually deep down on a physiologic level, like a hormonal level. And those influence too. Between both of those, there's a tremendous need for chiropractic. I'm going to elaborate just a little bit more about that. As that baby bump grows, you've got a lot of weight out all in one place, right out in front. And it shows up really quickly over time. And when it shows up that fast, you tend to have a little more strain on the low back. That's why pregnant women have a hard time. Sometimes they have back pain when they're sleeping or if they're standing for too long, that sort of thing. That's typically what happens is the weight's pulling that far forward. And then the hormonal changes that are happening on the inside are really happening because you're creating different things. So your body's secreting a hormone called relaxin. It's something it has in lower levels normally, but during pregnancy it kind of ups the ante a little bit. And you have more relaxin that's actually coming out, and it does, as the name suggests, it relaxes things. And as it starts to relax things, what actually happens is that normal integrity of the ligaments changes. So normally they're there to kind of limit your movement, but we need them to stretch and give a lot more. So as the relaxin's working, you lose temporarily that structural integrity that you had. And so because of that, you feel the effects of gravity and you feel how much strain that belly is putting on you towards the end of pregnancy more and more. And that's why more and more doctors are actually recommending chiropractic care to their patients during pregnancy.
We do know that pregnancy is one of the biggest changes that a woman can actually go through or experience. But as you mentioned, I mean, chiropractic care can sometimes make you have a more comfortable pregnancy. So can you elaborate a little bit more on that?
Absolutely. I mean, we were just talking about some of the pains. Low back aching is a pretty common one, but you can also have pain shooting down your legs, which is commonly known as like sciatic type symptoms. You can have fingertip numbness, that carpal tunnel type symptom. You can get headaches at different times. You can get heartburn, all sorts of things. And chiropractic's been shown to be helpful with almost all of them, which is just wonderful news. But my favorite, and this might shock you a little bit, my favorite one overall has nothing to do with symptoms during pregnancy. It has everything to do with labor.
With labor?
Absolutely.
And that is music to a lot of ears out there.
And that is proven. There is medical research out there. They did a study where they compared women who were getting adjusted regularly throughout their pregnancy versus those who weren't. And they found that the women who were getting adjusted in their pregnancy were actually having shorter labor times.
Ah,
yes.
So that's good to know.
Yes.
That is definitely good to know. So let's talk about how it works, because I know that there may be some pregnant folks out there right now, pregnant women watching our show right now, and they may have never even dreamed of getting adjusted during a pregnancy. So how does it work? I mean, is it something that's going to be painful?
Absolutely not. It normally feels wonderful. You almost feel like you get kind of addicted to that when you're pregnant because so few things actually give you relief. And this one really does. But what we're doing, even though we're giving you some great relief, we're actually optimizing the pelvis for the best ability to move. So we talked a little bit about that relaxin, and picture the bottom part of your pelvis. You have your tailbone sitting here and those two big pelvic bones that kind of look like elephant ears.
Right.
And you look at a spine, they're sitting there, and those three things are all attached, and they need to kind of expand and flex evenly from side to side. And they especially need to do that when you go to deliver that baby. So if one area is stuck and not really moving very well, and that relaxin's taking effect, you got everything else kind of slipping and sliding, and this area is not. So you end up with kind of a twisted, like oblong oval shape, and no baby's comfortable getting born that way. Most babies aren't even comfortable getting head down in that position.
So that really could bring on some complications.
Absolutely,
even.
some
so
things
really,
you wouldn't expect.
It sounds like it's all about getting your body ready for this process to take place.
Absolutely, and that easily explains why it shortens labor times. I mean, you're ready to go.
Let me ask you this, what age would you say is the youngest that you have adjusted, or that you know that can be adjusted?
I worked on my daughter hours after she was born in the hospital.
I've seen adults, athletes get adjusted,
Yeah.
and that kind of thing, but I can't imagine a newborn being adjusted.
It is not the same at all. I mean, yes, they have a spine, and yes, we're checking to see what's out of alignment so that we can correct it, but the corrections they match the size of the child. So if we're working on an infant, a lot of times parents will tell me, it looks like you just held my child. And all the time I'm working away, I'm seeing what's out of place, and I'm just letting the baby kind of move. And as I hold pressure on areas that are stuck, they can kind of actually move it on their own. I'm just creating the little fulcrum to actually get that movement.
I want to thank you, Dr. Arvin, for joining us today and providing us
welcome.
with all the information that you did. It's great to see you.
You too.
If you'd like more information on the Joint Chiropractic or any of our coastal experts, just go to our webpage at WSAV.com.